city's insurance or they take it from a spouse. And so when you start to lose those players in your pool, it really hurts your rate.
That's always the case, though. I mean, every employer has people who can opt out. I mean, you're not forced to ever.
No, there are some. No, there are some agencies where you do not have that option. You don't opt out. In fact, the brokers talked with us about that as well.
You're forced to pay the premium?
You're forced to. They pay for everybody to have a premium, and they don't give you an opt-out option. And we had that conversation with the brokers.
So even if your spouse has a...
Right. We talked about perhaps we might grandfather in people who we've already allowed to do that, but that for new employees, we may not do that. And that was, I think, a conscious city decision that they looked at, allowing them to kind of have that flexibility. There's no right or wrong on it, but that is something that this organization does.
And with the health care changes coming in 2014 and beyond, many of which are still to be determined, I'm not even sure that we could intelligently have that conversation right now. Certainly not today, but and I'm not only saying today, but many of those changes are still TBD.
The concern I have is NPR published rates to everybody prior to that meeting where we had to make a decision before, was it May? Was it April 1st?
April.
And even CBiz, who has referred business to NPR, some of their clients, they say NPR is a great option for you, probably smaller cities. They were under the impression that NPR was going to fund the HSA. So when I talked to CBiz and I said, were you surprised that NPR beat you? They said, well, how could that, what do you mean? I mean, they were of the opinion there's no way they beat us. We know what their rates are. We beat them. And so now we have this, after the fact, we have the city basically picking up NPR's, they basically bought down the premium by having the city pick up the slack, and it seems to me like there's something amiss when
they didn't know we were going to do that. That's staff's recommendation.
That's right, but that they would maybe not have been as competitive if we didn't do that, right? I mean, as you said, if we don't provide the incentive, all the numbers, I mean, none of this is written in stone, and all these numbers could go higher. So I guess from a broker's perspective, an insurance broker's perspective, it's easy to juggle the numbers and make assumptions such as we're going to do the same thing we did last year, which is provide an incentive from the broker to the employees, and then all of a sudden, once you got the deal, pull that incentive out. I mean, they basically, I guess what I'm saying is we have got to get to a system where we can get an honest appraisal of outside appraisal of what we have here without comparing NPR to the same plan at CBiz, because in my opinion, I mean, this just does not look right. According to CBiz, their bid was exactly the same as our bid was, as NPR's bid was last year, and I'm willing to bet that this bid is higher, but that wasn't the case when the bids came in, right?
I'm sorry, sir, I'm confused. CBiz is the broker. They didn't bid. Coventry bid, United Healthcare, all those other people bid. I'm sorry, I'm trying really hard to follow.
Using their insurance companies that they brokered.
Including NPR.
That's true. They were actually, they said that their rates, according to what they told me, were the same as what we paid last year, meaning 2012. And I guess my question is, at the time, NPR was supposed to be a better deal, right?
The rates that we got from CBiz were not less than the rate we got from NPR.
Right.
The rates that we got from, which was kind of why the recommendation came to not pull from that contract, because CBiz gave us rates that were higher than the NPR rates.
Now, when you factor in this, though, are they higher still? Is CBiz still higher?
Yes, because what we knew...
Seems to me it was around $36,000 to $40,000 difference.
NPR, the $25 that they're not putting in they took that $25 off of the premium. So
Right.
it's kind of a wash.
But it's costing us $36,000 more.
It would have cost you 60, the next highest bid was what, 60-something when we,
860,000 from Coventry, it's a $65,000
so
difference over what we're doing now.
$65,000 more if you had gone with one of the CBIZ
The
brokers.
NPR was 36.3, Coventry was the next highest at 65, United was the next highest at 129.3. And, may I
But
remind...
I think we get to kind of what you're talking about when we look at a dollar amount, and I think when we talk budget for 14, we should probably talk about a dollar amount that we want to provide for health insurance. And if we do that, then we can I believe we can accomplish what you're talking about, which is going out to see what we can bid and what we can buy for that fixed amount.
And we need to sync our budget with the plan.
And I think there's some
Because
carriers
right
who will
now,
do that.
I mean, I did read in here that, and I'm assuming that these rates that you show on the screen are the premium increases in July. Is that right?
Yes, sir.
That's
July
correct.
1st.
Now, that was factored in when we got our bids or not?
Yes,
Yes.
because that's our premium year. But I think we can find we had some conversation about that with the broker as well, and I do believe we can find someone who will sync up our budget year with the premium for the insurance.
Christie, did you have a question?
No, I don't anymore.
Okay. Does anyone else have any more questions? All right, thank you. At this time, open the floor to public comment on new business item number 7. With no one coming forward, I would entertain a motion for new business item number 7.
I move we approve new business item number 7.
Second. Motion Harrison, second Freeman, that we continue the city's share of health insurance premiums at 100% and 80% as aforementioned, which equate to $392 for employee-only coverage, $727.55 for Tier 2, $861.95 for family coverage, and fund employees' HSAs upfront at $500 for employees only and $1,000 for Tier 2 and family. Employees hired during 2013 will receive upfront funding at $500 and will continue the city's share of vision insurance premiums at 100 and also 80% as aforementioned, which equates to $754 for employee-only coverage, $1206 for Tier 2, $1723 for family coverage. All those in favor indicate by saying aye.
Aye.
All those opposed?
No.
Motion carries. Okay. New business item number 8. Consider passing an ordinance declaring it a public necessity to acquire land by condemnation and directing the city attorney to make application to the district court for the appointment of commissioners to appraise land and to conduct condemnation proceedings relative to the Big Bull Creek wastewater treatment plant sewer improvements and repealing ordinance number 2418 in its entirety. Does anyone have questions?
What will be the ordinance number on this?
2427.
Okay.
With no questions coming from council.
Actually, I'm sorry, Mr. Mayor, I do.
No worries.
At this point, I know we are still in the negotiation process. There's expectation by staff to reach an agreed-to settlement with the property owners on this, or do we, at this point, is there a reading on how that might end up?
We have no expectation at this time that we will come to an agreement with them. The offer is still out there. We are still open to negotiation, but there doesn't seem to be any movement on their part.
That's my only question. Thanks, Jim.
Thanks, Jim. Sorry about that. Any other questions from council? At this point, we would offer an opportunity for public comment on new business item number 8. If no one coming forward, I would entertain a motion for new business item number 8.
I move that we pass ordinance number 2427, declaring public necessity to acquire land by condemnation and directing city attorney to make application to district court for the appointment of a commissioners to to appraise land and conduct condemnation proceedings relative to the Big Bull Creek wastewater